Hey folks, it's Leah. Thank you for joining me today. Today I'm going to be reacting to a video of a TV show called My 600-Pound Life, which I've actually never seen. This is not a show that is played where I am, I don't think. I've sort of seen like previews of it on YouTube and stuff, but I am coming in totally fresh to this video. I'm feeling pretty good so far, but just based on the title of this show, I feel like I'm not going to be feeling very good for very long, but we'll see how it goes. It's called Doctor Now Argues with Patient Who Is Abusing the System. Oh my god. This is Leah Catnip. I'm gonna fly off the handle immediately, I'm sure. Anyway, let's start.
Margaret is 35 years old and is 750 pounds. Her BMI is 129.
Okay, right off the bat, BMI is bullshit. I'm gonna have to do a whole episode on why BMI is bullshit, but BMI is bullshit. It gives us literally no information except for like the amount our body weighs divided by the height of our body, which like doesn't actually tell you much. You could have a lot of muscle mass, you could have not very much muscle mass, like it's a completely useless number. Anyway, I'm 13 seconds in and I'm already mad. All right.
BMI I have ever seen. Yesterday, Margaret showed up here at the hospital because she and her mom were worried she was having a heart attack.
Yeah, that's a good reason to go to the hospital.
So we're gonna run some tests on her to make sure she doesn't have any life-threatening issues. Who takes care of you at home?
My mom.
Why is she providing you too much food and keep you at this weight?
Because it's easier not to fight me.
So how motivated you are to lose some weight?
I'm willing to do whatever I have to have my surgery.
If you go home and you're not...
Oh my god. I feel like so this doctor feels like an alien to me. Like he feels like an alien to me. The assumptions that he walks into the conversation with, he's like, who takes care of you at home? My mom. Why is she feeding you too much? It's like, we don't know what she's feeding her. Why are you telling us off the bat she's feeding you too much? There's so many assumptions. This is part of the reason why every time I make a video on the internet, people are like, there's no way you're that fat if you don't eat too much. And it's like, literally there are dozens of ways you can be fat and not eat too much. Like, I don't understand how this became the silver bullet of like all fatness is like you just eat too much. He just walks in and that is his just baseline assumption is that no matter what else is going on, she is eating way too much. It's so bizarre. And maybe that's true for Margaret, I think is her name. Maybe that's true for Margaret, but that's not true for everybody. So how can you just assume it the second you see somebody who's fat? It's so bananas. It's so bananas. Oh my God. I'm gonna lose my mind. Again, we're 49 seconds in and I'm about to throw something.
You think your mother is going to be on board with this changes?
Yes.
So,
She's on board.
okay. Any questions?
Just please help me.
All right, I'll be by and see you later, okay?
I need his help because things are bad. And they're just getting worse.
Ugh. So... literally, she's not going to get thin changing what she eats. She's not going to get thin changing what she eats. As somebody who's been in a fat body her whole life, I can tell you that there have been tons of times that I've changed everything that I eat, that I've obsessed over every little thing I put in my mouth. I'm still fat. In fact, I got fatter the more I did that. And so, like, the idea that this is a doctor and he's so anti-science, like literally all of the research tells us that his approach is not what's going to make her thinner, that probably nothing is going to make her thinner, but insofar as something might, it's not going to be her basically adopting a new eating disorder. If she's eating way too much, she might have a binge eating disorder. The answer to that is not giving her anorexia, right? Like the answer is not going from one eating disorder to another. The answer is trying to heal your relationship with food, possibly. And like, even if you do that, that's not to say she's going to get thin. Like, we don't know how to make people lose a significant amount of weight. And he's saying that she weighs, I think he said 700 pounds or something like that. A lot of the things that we read about, you know, this thing works to make people lose weight. And like, they're very modest figures. Like typically it's between like 10 and 15% of your body weight. If this woman loses, let's be generous, 15% of her body weight, she's still going to be over 500 pounds. Like literally this size of body, you can't just like be a person who is reasonable and who has any sort of self-interest, any sort of self-preservation, anything. Like people don't just become this way because they're like, you know what? I think I'm just going to stuff my face constantly. I'm going to never get off my ass. I'm going to do nothing to try to improve my situation. Like, that's just not how people are. It drives me insane. The way that we approach this stuff, like listening to him talk to her, I'm just like, dude, you're making as though she just woke up one morning and was like, you know, it'd be really great to be the laughing stock of everyone who sees me. Because that's what happens when you have a body this size. You cannot be seen in public without people aggressively ridiculing you all of the time. Nobody wakes up in the morning and says, you know what? This is the easiest path for me. I'm going to take it. I'm going to come to weigh 700 pounds, whatever it is, 400, 500, whatever. It's just so bananas to me. It's so bananas to me that people think that anybody in the world thinks it's easier to just sit on their butt and stuff their face all day and deal with that kind of harassment and ridicule and not be able to leave your house than it is to just try your best. And like, maybe your body doesn't fucking cooperate. Maybe that is the case. Like, I can't imagine a world where this woman's body is like fighting to be thin. It's not. Like, there's just no way that this woman's body is fighting to be thin. Her trying to become thin, it's obvious to me, it would be an uphill battle. Her body is fighting to stay fat. And that is a feeling that some people have when they're trying to become thinner. It's like your body will fight to become at least as fat as you were, if not fatter. Bodies do not like to lose weight. Fat is a resource for survival. They literally are like, oh man, I noticed she's been eating less. Maybe there's a famine coming. Maybe like there's some reason why we're not going to have access to food. You know what? We're going to make sure she's safe. We're going to store a bunch of fat on her body. And then if we're in a famine, she's going to have resources. She can have something that'll keep her going until the famine's over and we're safe again. Literally, that is what body fat is. That is the body protecting you. And so like bodies do not like losing weight. Bodies do not like burning fat. It's actually a really poor source of energy for your body. Glucose, which is what most food that you introduce to your body will break down into. It loves glucose. It's a great source of energy. It does not like using your fat as energy. It's an inferior type of energy. I know this tirade is incredibly long and we're like a minute into this clip that is 10 minutes long, but it just makes me so angry. And like, I get mad when people do this to me. When I see them to do it to other people, I'm just like, oh, I'm gonna kill somebody. Not really. Okay, let's resume. Now she's already crying. We're 1 minute in and she's crying. And she's saying to him, yes, I'll do whatever you say, you know, whatever. Like, there are two possible reasons that she's saying that. One is because she believes it. And she's like, yes, I really think there's something wrong with me. I want help. The other, which is also very common, is I actually don't agree with what you're saying, but I know I'll never get the medical care I need if I don't go along with what you say. So I don't know which is happening. The fact that she's crying, I think, is like a lot of cases, it's shame. Like there is shame associated with what she's doing. So like if she's saying, yes, I'm going to do what you asked me to do, it could be that she's ashamed that her body is the way it is. That's a possibility. It could also be that she's ashamed that she is going along with something that she does not believe in. I don't know which way it's going to go. I just know that this lady is really upset. I know that he's expecting things of her that I don't think are possible for her. It's just like, for what? For what? If we don't have a solution for her, how can we expect her to change her body? We don't have we don't know how to make bodies thinner. Like, how do we expect her to change? We don't know. Anyway. Oh, okay. My tirade is done for now. Let's resume.
I need his help because things are bad, and they're just getting worse. I know I've let myself get to a breaking point, so I have to change now, because if I don't, it's going to be too late for me.
So she says, I've let myself get to a bad point. I can't remember how she phrased it exactly. I've got to change, or there's something really bad going to happen. And it's so hard to know, like, what that process looked like for her if she doesn't tell us, right? Like, we don't know if that process looks like she had like a terrible time trying to stay thin and she fought it the whole time and she still got fat. All we know is that she's super ashamed and it seems like she's scared. And so, like, I just don't know where that comes from. If it's like a thing where she's like, yeah, I believe that, like, I fucked up because I know how I've behaved, and the way I've behaved seems like I've fucked up, versus like there's also the option of like, I'm not sure if I have actually fucked up, but like I know that what the doctor is telling me is like really scaring me, so now I'm scared and ashamed even though I don't actually know what I did wrong, because my body has kind of just decided to be this way and I don't know how I did it, but all I know is that now I'm really ashamed and scared. And like if it's the latter, that makes me really mad, because that happens pretty often. Margaret, 1 year and 2 months.
We have had Margaret in the hospital.
Oh, God. Do they... I hope to goodness they get permission from the people in their show before they have these shots where they're just like showing so much of their naked body to the camera. Like, that's... like, this is the whole world watching. Like, you would think that someone who's in a medical situation would want a bit of privacy, but they're just like lifting up her gown and just like showing all of her belly. I'm sure like they would stop before her breasts were showing because it's television, right? And they're not allowed to do that. But just like I don't know, just like showing so much of her bare body, it just seems really questionable and like not necessary. Like it's there just to cause some kind of like shock reaction or something. I don't like that. I don't like that they're just like hiking up her gown and like showing so much of her bare skin and her, particularly her stomach, which of course is where a lot of us carry our fat. Like it just seems really salacious and not respectful whatsoever.
We cleared her infection and we got her weight down to 505. What we're doing is making some progress. But the problem is Margaret isn't making progress on her own. She wasn't cooperating with her PT first 3 weeks. But we have got...
He said something about she had an infection. They cleared that. And they said they got her weight down to 505, I think he said, which is 200 pounds less than what he said she weighed before. Like, that is a substantial amount of weight. As I was saying before, like, when we talk about, like, ways to become thinner, like, it is considered very successful if you have some method that allows you to lose 10 to 15% of your body weight. The idea that she managed to get 200 pounds down, do I think she should have had to do it? No. But as I say, full credit to Margaret. If that was something she wanted to do, like full credit to her.
Occasionally doing some exercises, but she mostly just throws fits and tantrum. Tries to manipulate for pain medicine, sleep all day and does nothing, and wants her mom to come take care of her.
Now we have more shots of her belly that, like, I can't imagine if I was going to be participating in a show like this, I would not consent to showing my bare skin all over the place. Like, this is my body. The whole world doesn't get to see my body, right? Like, it is so salacious the way that they show it. Like, they're trying to elicit a reaction. Like, this is incredibly exploitative, the way that they do this. And then he's like, oh, well, she won't cooperate with her physiotherapist. All she does is throw fits and tantrums, he says. Really? Really? Cries to manipulate for pain medication because she couldn't possibly be in pain. Okay, good thing that you know if she's in pain better than she knows if she's in pain. And then he says, sleeps all day and does nothing. There's something really not adding up here. He's making like, she won't move. She won't do anything. She just sleeps all day. She throws tantrums, wants pain medication for pain that doesn't exist. You know what? If I had to deal with you, I would want my mom to come and take care of me too. This guy is awful. I don't like this guy. He is not in my good books.
Hey, Margaret.
Hey,
How are you today?
doing okay.
Are you awake?
Mm-hmm.
No, she's sleep talking to you.
Sleep.
Anyway,
Yesterday I was just...
I hate
dealing
this
with
guy
my
so
medicine and
much.
All right, so did therapy come in today?
Yes.
Did you work with them?
Yes.
So what did they do for you?
We need to up the foot pill. We need to up it because she said I'm swelling really bad down there.
Well, yeah, but that's not the question. The question is what did therapy do for you?
Oh, we worked with the legs. She
Uh,
made me work with that right leg.
What's wrong with your right leg?
It just doesn't work.
What do you mean doesn't work?
It hurts to do anything with it.
So what causing that? When you left the hospital after you had weight loss surgery, you were walking. And now you can't, and you just stay in the bed.
Oh boy. All right. Now I know what's happened. So what they did was they did some kind of weight loss surgery on this lady. After that, I presume is when most of the weight loss happened. I mean, he's mad at her already. Just wait till she gains all the weight back, which is often what happens with weight loss surgery. But anyway, the idea that he's like, you were fine when you walked out of here after your weight loss surgery. How come you can't use your leg anymore? Is like bizarre to me. It's like she's telling you her leg doesn't work. Like, do you think she's just lying to you? It's like... It blows my mind how much this guy is just kind of like, whatever she says to me is not true. Like, he just doesn't believe anything she says. He seems to think she wants to, like, deceive him constantly. It's so bananas.
Why are you going to that dark area that you want? Why? Is that what you want?
No.
Yes, she does. Well, the problem is that you just saying things for us, but you have intention opposite of what you're telling us. All the thing indicate that you don't want to get better, you don't want to walk, you don't want to lose any weight.
Doctor now presumably has a medical license. I don't know why, because, you know, he's a mind reader, so he can just know the answer. You know, presumably he would just have all the answers. Why did he bother going to med school? Why did he bother, you know? Why does he bother asking her questions? He's a mind reader. He's just said, you say one thing, but you intend something else. How do you know she intends anything else? I haven't been this angry in a really long time. I really hate this doctor.
And you want to get pain medicine and all kind of narcotic and stay in the bed. So why are you doing all this? What do you mean by?
I'm not arguing.
Okay, it's not arguing. Just answer the question.
He isn't asking questions anymore. He's just making statements. You don't want to get better. You don't want to walk. You don't want to lose weight. You just want to get pain medications and stay in bed all day. Again, why did he bother asking anything if he just knows all the answers? Because he knows everything that she's thinking better than she does.
I'm done talking.
You what?
And now she's getting mad. I mean, girl, you made it so much longer than I did. But she's getting mad and he's making like she's being pissy about it. I'm not arguing with you, she says, which is, you know what, girl? You are a better person than I am. It's not arguing. Answer the question. Where was the question? That sounded like a lot of statements to me.
I'm done talking.
You're not going to talk because you don't want to admit it.
Oh, it's so true. Yes, it is.
Just answer the question and talk. And don't lie about it.
I have nothing to do.
This is malicious compliance at its greatest. Oh my God. She's like, yep, you're right. Everything you say is right. Goodbye. Oh, Margaret, I love you so much.
Okay, we did the weight loss surgery on you, and you're responsible for your health.
Yep.
This is not in here to sit down and manipulate everything and get everything you want. You're abusing the system, and this is not the way that you're going to scream and cry and get your way out of it. That is not the solution for your problem right now. So, are you going to change, or do you want to continue what you're doing right now? Be honest about it. Don't lie about it. If you want to stay in bed and eat yourself to death and not walking and let everybody leave you alone and not do physical therapy.
I mean, to her credit, she's just kind of like, I'm not talking to you anymore. She's not like yelling at him. She's not actually really even fighting him. She's just like, yep, you're right. Fine. Go away. Like, and he's just sitting there being like, you're manipulating the system. You're like crying and throwing a tantrum to get whatever you want. Like, he's really treating her like a child. And like, If you're going to treat somebody like a child, they're not going to respond well to that. If she's saying, I have pain, then she has pain. Like, you're just assuming that she's lying. like what evidence do you have that she's lying? Like, it's so bananas. I don't get it. That is not the solution for your problem right now. He doesn't know what the solution is. This girl is going to be the same weight that she was within 5 years after her weight loss surgery. That is what happens statistically. People just gain it back. And he's standing here like he has all the answers. He's almighty. He knows everything. And lecturing her like she's a child. Like, come on. Get over yourself. Get over yourself.
What are you crying because you want to manipulate people to agree?
Yeah, I've been with the system. I did it all.
You're not going to be able to manipulate your way around me.
I'm done. I'm not dealing with this.
Margaret, you may be able to manipulate other people to get what you want, but you're not going to be able to manipulate me. We did the surgery and we told you go home and keep working.
One of the people in this conversation is a so-called professional. One of them. Not the one who is behaving in a civil way. Not the one who is minding their own damn business. It's the one that is berating somebody like they're a child. It is the one who is saying inflammatory things like, are you going to eat yourself to death or are you going to do what I say? Like, come on. Get over yourself, Doctor now. More like, I think my name is Dr. God. Fuck you, man. Oh, I'm so mad at this guy.
Come get me now. Come get me now. Yes. I don't care. I'm done. You either come get me, Mama, or I'm missing bigger. I don't want to get out of here. I'm done.
Margaret, put her on speaker.
Hello?
Yeah, put her on speaker and let me talk to her.
She's at a restaurant. Hello? Hello? Can you hear me? Yeah, what? Dr. Now wants to talk to you.
How do you think people respond to being treated this way? Like, have you forgotten that this is a person who has feelings? This is a person who has feelings, just like you do. Your feelings are pretty damn fragile as well, because you're sitting here being like, do what I say or else I'm going to say that you're going to die. That is the most fragile shit I've heard in a really long time. This is really difficult to watch, honestly.
Well, we're trying to help Margaret, and she's throwing a tantrum.
Excuse me? That's how you summarize that situation? We're trying to help her and she threw a tantrum? Wow. We have this assumption that because she didn't lose additional weight, that she hasn't done anything. These people specialize in cutting open your abdomen and mutilating a perfectly functioning organ in an attempt to make you thinner. Like, that is, like, when you think about like medicine and how we're supposed to promote things functioning well in our bodies and everything, the idea of doing an operation to make a functional organ less functional is batshit crazy. So you specialize in this field where you're going in and you are cutting people's bodies apart, making these adjustments to organs that are working fine to make them work less well, all to make people lose weight. And you're standing here making like it should be easy to lose weight. If it's so easy to lose weight, where's your job coming from, huh? Why do you have to cut people open to make them lose weight? I don't even know if I would have been able to get out of there, but I would have been a friggin' wreck. I can't believe how well she's doing.
Mostly on her. I told her she had to be up and standing and walking when she come home.
All right, Margaret. So everything is up to you at this point, okay?
I love her, but she's got to get on with life. That's the whole thing that I said from the very beginning. I did not want her to just exist. I wanted her to learn to live.
Well, she needs to hear that, and she needs to understand.
Wow. She's got a trash mom. She's got a trash mom. If she's calling her mom and her mom's like, what's going on? And she tells her and then the doctor says something different and she immediately trusts the doctor, that is a trash mom. I'm sorry. That is a trash mom. He's saying she's not answering questions. I didn't hear questions in there. I heard a bunch of statements from him. A bunch of assumptions that he stated. And then he's like, why aren't you answering my questions? Well, maybe ask a question. Maybe if you asked a question, she could answer them. And then her mom's like, don't come home unless you can stand and walk. Thanks, Ma. Thanks for that. That's really helpful and productive. Really appreciate that. Oh boy, this poor woman.
You need to follow what we're telling you, follow what you're telling her. Because you want the best interest for her, and she needs to understand that.
But I did tell her that she had to be up and standing and walking because she's not just going to sit there and lay in that bed and waste away and take the chance of getting a DVT, nor is she going to lose muscle mass because of a fear.
So, Margaret, you're going to have to follow what we're telling you, what your mom is telling you, because we have an interest in getting you well. You think you can do that?
Margaret, I love you, but guess who put you there? And I think he's the best option versus a mental hospital because a mental hospital cannot provide you with PT and medical treatment. I'll call you back as soon as we get through eating.
Okay.
I've known people who have been confined to bed. They were thin when they went in the bed and they were thin when they came out of the bed. The idea that nobody has even tried to figure out what is causing her to be the size that she is just baffling to me. There's something going on, obviously, that makes her body put on weight in ways that other people's bodies don't have. Obviously, that is true. There are people I know who can pack in like twice as much food as me and they're thin. Like there is a difference between her body and other people's bodies. What is that difference? Has anyone taken any time to ask that? What is happening? Her mother being like, I love her, but listen, the second you have to put a but after the statement, I love her, maybe look at yourself in the mirror and figure out what your priorities are. Like, do you love her? Do you not love her? But is not something you want to say after I love you. People, do they think that like this is easy? Like, do they think that that fat people look at the options in front of them and they say, you know what? This route sounds great. No one gonna treat me bad. Never gonna have people tell me I'm about to die. Never gonna have people berate me and treat me like a child. And then when I understandably am upset about that, they're definitely not gonna tell me I'm using tears to manipulate them. Who would choose that? What the fuck? Like, I'm sorry, but what the fuck? Oh boy.
Margaret, you need to get away from this frame of mind. We're not here to telling you what to do because we want to torture you. We're here to get you to change your life, okay? But you're going to have to do hard work to get there. You understand what we're saying, right? You understand we're here to help you out.
This narrative of we're here to help you out, we're not here to torture you, these are the person who recommended this video. I see you. These statements are meant to suggest that there is sort of a binary. There are two options only. Either the medical people who are working with Margaret are trying to torture her, trying to commit medical abuse, trying to be bad people, or they're trying to help her and nothing they say could possibly be wrong. It is never that way. You don't have medical professionals. Well, I guess there are some people who are like, yeah, there have been some like serial killers who are nurses and stuff. But for the most part, medical professionals are not like trying to torture anybody. But the thing is that just because you think you're right and you think you're doing what's good for the person does not mean you're perfect. It doesn't mean you don't make mistakes. It doesn't mean you don't cause harm. You can be well-intentioned and have terrible impacts. I'm very confident that when I was in the hospital and I was for 3.5 days to the point that I was vomiting from hunger, I'm sure that they thought they were doing me a favor. They probably thought they were being very, very good people who were helping me out. After I left the hospital, I immediately got fatter because my body was like, apparently there's a famine. Better stock up. And I think it's like absurd to think that medical professionals who are people don't have the same normal human biases that every other person has. They're just people. Sure, they know more stuff about medicine, but the thing is, even in medicine, if you want to get an answer, you have to know the questions to ask, and your questions are influenced by bias. And that's what we're seeing here. He asks her all these questions that are influenced by his assumptions he's making about her. And then he has the nerve to stand there and be like, do you think I'm torturing you? Or do you think I'm helping you and everything I say is correct? And that is not a binary option. That is not reflective of real life.
We're going to push you to get your life changed. We're going to do everything we can to change your life. And this is for your own good. Okay? So,
this is so heartbreaking. This poor woman has been broken down. He says, this is for your own good. This is abuser language. He's like, it's going to suck and it's for your own good. This is abuser language. How is it that it's for her own good and she has to be convinced of it, even though the way that her life is now, she's not happy with it. It's clear that she is not happy where she's at. You know, she's talking about how she has pain in her leg and so on. Like, there are things that she's really not loving that's happening in her body right now. But you're still saying it's for your own good, as though like she needs to be convinced of like becoming better. But she already wants that. So like the idea of like, this is going to really suck, but it's for your own good. It's like, this is the kind of stuff that people say to manipulate and to abuse. And I find it really fascinating that her actually very understandable response to him berating her crying, he calls that manipulative. But then he stands here and he says, well, do you want to die or do you want to do what I say? Sorry. That is manipulative. You're giving her two options. Either she's going to die or she's going to do what you said. And that is fully driven by your ego. She's telling you that what you're doing is not helping her. I hate this guy.
you think you can do that?
She's so broken.
Yeah.
All right, Margaret, do you exercise and work with the PT?
Okay.
You think you can make all those changes that we're talking about?
Yeah.
And stop throwing tantrum, because we are here to help you out, okay?
Yeah.
And I want you to take some of the stress off of your mom, because you're causing a lot of stress because you're not making the progress like she's expecting you.
Like, fucking excuse me? She's in the hospital. She's not feeling well. These are all changes to her life. And he's being like, you really better think about your mother. You know? You're really stressing your mother out. There's this thing that my partner and I, Eli, who you've met on the channel, hi. We talk about this thing that's called, comfort in, dump out. Something like that. Yeah. Basically, if you picture like everyone's world is like a little onion where like we are at the center of it. And in this scenario, it would be Margaret. And if you use like kind of the rings to be like, okay, on the first ring outside of Margaret is like people who have like a really close, intimate relationship with her. People like her mom, her like extremely close friend who's like a sibling, you know, things like that, who are like really right in the center of her world interpersonally, right? And then outside of that, you would kind of gradually go further and further out to like the outer rings are like some guy you met at a conference 10 years ago, right? Like the idea is that when we think about where we are in that onion, her mother is not the center of the onion. Her mother is on the next ring out. Way further out than that is Dr. Now. And so this guy who's way out in the outer rings, he's being like, hey, Margaret, I'm going to dump all of this pressure on you on behalf of your mother, who I've probably not even discussed this with. I'm going to make you feel bad about that. The idea is that he's dumping inwards in the onion. You want to dump out. If you want to be kind and you want to be compassionate, you want to be Dr. Now going home and telling his wife, oh, I had a terrible day. I need to tell you about it, because she's even further out in the onion. She's never met this woman, right? You don't want to like go into your friend's hospital room when they're sick and be like, buddy, I'm so worried about you. I've been losing sleep. I can't get over how stressed out I am about you being sick. Like, no, you want to be like, hey buddy, how are you doing? You're looking great. I'm so glad that things are looking up for you. And you comfort in. You say like all the things that you think that person might need to hear to feel better. And then when you get home, you say again to your buddy or something, oh man, my friend's sick. I'm really stressed out about it. You dump out. This is just a prime example of him dumping in. He's like, you know, Margaret's at the center of the onion. So there should be comfort coming her way. There shouldn't be him from the 57th ring of the onion dumping in and being like, your mother's stressed out about this, you know. This stuff that really affects your life, it's stressing out your mother. Dude, stop. Just stop.
All right, Margaret. Let's see if we can get you in better shape, okay?
Okay.
All right.
This
I'll
is a
see you
woman
later.
who has given up. She's just been completely worn down. by him, and she has no fight left in her. She's not agreeing because anything he says is more correct than when she was arguing with him. She's agreeing with him because she's like, I just need to do what I can to get out of this situation. And that's so sad to see. Like, congratulations, Doctor Now. You have traumatized her to the point of her being essentially in a fugue state. Good job. So this is my reaction to this episode of My 600-Pound Life. This is the first time I've seen this show, so it was definitely something, an adjustment, and something that raised my blood pressure considerably just watching it. I think the thing that really sticks out to me in this show, unless this is an outlier, but I'm guessing this guy behaves this way with pretty much everybody. This guy does not seem to have any sense that these are complete human beings he's talking to. He just sort of assumes that they're lying. He cannot conceive that, like, maybe he is a little bit like them. So he can't make basic assumptions that would be more accurate, like that, like other human beings, fat people actually do want to live good lives, right? He immediately assumes that she's crooked, lying, trying to cheat the system. He implies, without saying, that she is working on a painkiller dependency because she doesn't actually need them. She just wants them. Like, all of these implications are things that we say about people that we've dehumanized. Because actual people that we see as actual people, we're able to recognize enough of ourselves in them that we don't make all of these wild assumptions about them as though they're aliens. I think that's sort of my main thing here, is that Doctor Now really does not, and I'm sure he would argue with me if I said that to him, but he does not realize that these are actual human beings. He does not see them as human as him, because there's no way that you talk to somebody that way and you're shocked when it upsets them. That you go to a place of, well, you must be manipulating me because you're upset because I've been standing here shouting at you. I've been telling you that you're going to die. I've been telling you you're doing everything wrong. That is a very normal human reaction, to feel upset at that. But again, he doesn't see her as fully human. He doesn't understand that she has human reactions like humans do. So instead, he goes to a place of, she's trying to manipulate people. This guy's a real piece of shit. I do not like this guy. That's my main takeaway from this show. I do not like this guy. I think this is maybe the first and last time I'm going to watch something from this show on the channel. I hope that was entertaining, educational, funny, something? Question mark? Please do give the video a little like if you got a little something out of it. I recently learned that about 85% of people who watch my videos are not actually subscribed. So, like, if that's you, try subscribing. I upload a video every Wednesday. And so if you hit the little bell, you'll get a notification when I upload as well. Other than that, thank you for joining, and we'll see you in the next one. Bye-bye for now.